Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's now understand the ocular embryogenesis. So, ocular embryogenesis. So, I'll be talking about the duration and what are the major milestones which are seen. So, first it begins with 3 weeks, 4 weeks, and the 1 month. So, and it goes up to 9 months. So, let's break it into parts. That is, first let's look up to what happens 3 months. So, let's look at 3 weeks to 3 months. So, first let's break it down to 3 weeks to 3 months. And later on, we'll be looking at how it transforms from 4 months to 9 months. So, from 3 weeks to 4 months, what are the changes? So, first is in terms of 3 weeks, there is an optic groove. So, optic groove is what appears at 3 weeks. Next is 4th week. 4th week, it is an optic pit. So, it is a pit. Optic pit. It develops into optic vesicle. So, it develops into optic vesicle. Next is the lens plate forms. Lens plate it also forms. Then the embryonic fissure. Embryonic fissure also develops. Then comes we look at the first month. So under the first month, what are the changes? So by the end of 4th week, you have the lens plate, embryonic fissure. So by 1 month, you look for the lens pit, it develops again. The lens pit, there is development of the lens pit. Next is, there is also the formation of the lens vesicle. Lens vesicle is formed. There is a hyaloid vessels. So HV. So hyaloid vessels, it develops. So we spoke about the 3 weeks, 4 weeks, then around 1 month, and then 1.5 months is what we are discussing now. 1.5 months is closure of the embryonic fissure. 1.5 month, it includes a closure of the embryonic fissure. Closure of the embryonic fissure. So there is a fissure and embryonic fissure, closure of the embryonic fissure. There is the differentiation of the retinal pigment epithelium, RPE. RPE. 1.5 months. So RPE. Next is the appearance of the eyelid folds and appearance of the eyelid. So appearance of the eyelid folds. So you have the appearance of the eyelid folds as well as the NLDs. NLD is nothing but the nasolacrimal duct. So all this takes place in the 1.5 months. Then moving on, we look at what happens in 7th week. So let's begin the 7th week. So under the 7th week, there is embryonic nucleus of the lens. There is embryonic nucleus, E nucleus of the lens. Next is the scleroid begins to form. The scleroid begins to form. Then the migration of the waves of the neural crest. There is migration of waves. And this is nothing but of the NC, that is a neural crest. Then there are 3 waves. So there is migration of the waves of neural crest. Wave 1, wave 2 and wave 3. Wave 1 leads to the corneal as well as the trabecular endothelium. Wave 2 leads to the corneal stroma. Next comes the 3rd wave, that is the iris stroma. Next, moving on to the 3rd month. 3rd month is where there is a differentiation of the precursors of the rods and cones. So differentiation of the rods as well as the cones. Next is the anterior chamber, it appears. So anterior chamber, it appears. Next comes the fetal nucleus, it starts to develop. the F nucleus. F nucleus is nothing but the fetal nucleus. It starts to develop. Then comes the sclera, which is it condenses. Sclera, it condenses. So now, as we spoke, we started with 3 weeks and 3 months. So let's quickly recap some important points. So starting with 3 weeks, we saw it is the optic groove, which was formed at 3 weeks. And 4th week, we have the optic pit. So pit develops into the optic vesicles. Then there is also the lens plate. And the embryonic fissure, it develops. Next, talking about the 1 month. It's a similar thing, that is the lens pit is develops. The following formation of the lens vesicle is also present and the hyaloid vessels is forming. Then moving on to the 1.5 months. We discussed 1.5 months. That stands for the retinal pigment epithelium. So retinal pigment epithelium differentiates, and we discussed the embryonic fissure, it develops by 4th week. So this embryonic fissure, it develops, so it closes. Then talking about the eyelid folds, so there is appearance of the eyelid folds. So appearance of the eyelid fold and also the NLD, that is a nasolacrimal duct. Then moving on to the 7th week and the 3 months. So 7th week, we spoke about the embryonic nucleus. The embryonic nucleus of the lens is there, as well as the sclera, it begins to form. Next will be the migration of the waves of the neural crest. So migration of the waves, and this is of the NC, that is a neural crest. And next is we have the 1, 2, 3 waves. So what are these waves indicating? So the first wave is the corneal and the trabecular endothelium, CT endothelium. The second wave and the third wave. Last wave will be the IS, that is the iris stroma. The third wave is the iris stroma. The second wave is the CES, 2CS. So 2CS, that is second wave, is the corneal stroma. And the first wave being the corneal and the trabecular endothelium. So what is the 3rd month about? The 3rd month, the last month in this category, we saw the anterior chamber develop. So it differentiates in the precursors of the rods and cones. The anterior chamber, it appears, as well as the fetal nucleus, it starts to develop. And the sclera, if you see it, condenses. So differentiation between the rods and the cones, anterior chamber, it appears, and the fetal nucleus, it starts to develop. Next, we move on to the 4th month to the 9th month. 4th month to the 9th month. So what happens in the 4th month to the 9th month? So under the 4th month, it is the formation of the retinal vasculature. It begins. Retinal vasculature. So 4th month is very busy. There is a lot of changes taking place in the 4th month. So there is formation of retinal vasculature, which begins. The hyaloid vessels, it regresses. The formation of the physiological optic disc cup. So formation of the physiological optic disc cup, as well as the lamina cribrosa, LC. Next comes the canal of Schlemm. The canal of Schlemm. So canal of Schlemm, it appears in the 4th month. The Bowman's membrane also, it appears. The formation of the major arterial circle and the sphincter muscles. So sphincter muscles of the iris, it also develops. Then moving on to the 5th month. So all these are the 4th month. Next, moving ahead with the 5th month, the photoreceptors. So 5th month is where the photoreceptors, it differentiates. The photoreceptors. So photoreceptors, it differentiates. Next is the eyelid, it separation begins. So there is presence of eyelid. So the eyelid separation, it begins. Now this was about the 5. Now let's look at 6. Month 6. So month 6 is differentiation of the dilator pupillae. So differentiation of the dilator pupillae. There is also presence of the nasolacrimal system. So there is a differentiation of the dilator pupillae, there is a nasolacrimal system, as well as it becomes nasolacrimal system, it becomes patent. And there is also a cones differentiation. Cones differentiation. Next, we move on to the 7th month. So what is happening in the 7th month? So here in the 7th month, the rods it differentiates. The rods it differentiates. In the 6th month is a cone which differentiates. In the 7th month is a rod which differentiates. And there is a myelination of the optic nerve. It begins. Myelination of the optic nerve. It begins. Next, looking at the 8th and the 9th month. So let's discuss the 9th month first. 9th month there is a pupillary membrane. It disappears. The PM it disappears. PM disappears at 9th month. So P9 for P, it's a mirror image. So in the 9th month is the pupillary membrane which disappears. The 8th month it is the hyaloid vessels which disappears. 8th month is the hyaloid vessels. So hyaloid vessels it disappears. And there is also completion of the anterior angle of the eye. So completion of the anterior chamber. Completion of the anterior chamber angle. So this is in the 8th month. Angle, 8 angle, that is a completion of the anterior chamber angle. Now let's quickly summarize some important points from the 4th month to the 9th month. So in the 4th month, some important points being the retinal vasculature, it begins. The hyaloid vessels, it regresses. Then the canal of Schlemm, it appears. The Bowman's membrane, it also appears. Then the formation of the major arterial circle and the sphincter muscles of the iris. Next is talking about the 5th month. The 5th month is the photoreceptors. 5th month is the photoreceptors, it differentiates. Then in the 5th month, the eyelid separation begins. The eyelid separation, it begins. Then talking about the 6th month, there is a dilator pupil. Dilator pupil muscle, it differentiates, as well as there is a nasolacrimal system. Nasolacrimal system, it becomes patent. And the cones, if you see, it differentiates. Cone, it differentiates. Then comes the 7th month. So under the 7th month, the rods, it differentiates. The rods, it differentiates, as well as the myelination. Myelination of the optic nerve begins. So myelination of the MON, myelination of the optic nerve begins at 7th month. Next, moving on to the 8th month. So what do we have in the 8th month? 8th month is a completion of the anterior chamber angle. So anterior chamber angle. So angle, anterior chamber angle, it completes, and the hyaloid vessels. So you have a structure 8. So hyaloid vessels, it disappears. Then comes 9. We saw 9 is the mirror image. There's P, there's a papillary membrane, it disappears. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.